Welcome to the Electrophysiology of Arrhythmias and Advanced Interventions, presented by AstraCura. When a patient presents with severe palpitations, frequent dizzy spells, episodes of syncope, or compounding heart failure, the immediate clinical focus is often on the mechanical failure of the heart's pump in action. But to resolve that mechanical failure, we must look past the muscle. This model shows the heart as an electromechanical pump. As the outer muscular layer fades away, we expose the inner electrical conduction system, the SA node, AV node, and his Purkinje network. Mechanical failures are downstream effects of primary faults within this specific circuitry. The electrical pulse can be severely delayed, resulting in a critically slow bradycardia, or misfire erratically, driving dangerous rapid tachycardia. Historically, managing these erratic rhythms relied on broad-spectrum medications or basic pacing that lacked structural precision. Today, resolving these issues requires exact anatomical targeting. Modern interventional electrophysiology has moved toward highly specific structural and electrical corrections designed to restore total cardiac synchrony. Curing an arrhythmia permanently means treating the heart as a short-circuiting electrical grid, repairing the specific pathways that drive the mechanical pump. Take bradycardia. This condition is often driven by an electrical block in the AV node, a structural failure that traps the natural heartbeat and prevents the signal from reaching the ventricles. The traditional solution involved surgically creating a subcutaneous pocket in the chest to house a pacemaker, then threading transvenous leads into the heart tissue to stimulate the muscle. Today, we utilize a far more targeted modality, conduction system pacing. Looking at this vector schematic of an AV node block, you can see how conduction system pacing functions as an electrical bypass. The pacing lead bypasses the block entirely and connects directly into the His bundle or the left bundle branch. By tapping directly into the heart's natural electrical highways, the artificial pacing signal is distributed down the native Purkinje network, creating a highly organized, unified wave of contraction. For certain patients, we eliminate the leads entirely through the use of leadless pacemakers. This delivery process is entirely transfemoral. As visualized here, a medical catheter tracks upward through the inferior vena cava, emerging directly into the right ventricle. From there, a self-contained, capsule-sized pacing device is deployed and anchored straight into the myocardium. This eliminates the need for surgical chest pockets. Without transvenous wires, the long-term risks of lead fractures and systemic infections are removed. Modern management of slow rhythms utilizes invisible micro-interventions that integrate directly into the native anatomy, replacing the need for bulky hardware. Beyond isolated slow rhythms, electrical delays can trigger a compound crisis in the form of cascading heart failure. If a patient develops a bundle branch block, the pathway carrying the electrical signal to one side of the heart is severed. This breaks the simultaneous firing of the ventricles. This diagram illustrates the resulting mechanical dyssynchrony. The graphic waveforms show the right and left ventricles contracting out of phase, producing visible backflow and a drastic reduction in pumping efficiency. To correct this, we use cardiac resynchronization therapy, or CRT. CRT operates as a highly calibrated system of biventricular pacing. The system delivers simultaneous pacing signals to both the right and left ventricles. This forces the separate chambers to match their timing, immediately snapping the asynchronous contraction back into a unified, powerful pump. While standard pharmacological approaches attempt to manage the symptoms of a weakened heart muscle, they cannot fix a structural timing error. In cases of complex heart failure, the most effective way to restore mechanical output is to physically recalibrate the electrical timing. Conversely, when the timing error accelerates, we face the chaotic velocity of rapid arrhythmias, including atrial arrhythmias, ventricular tachycardias, and frequent ventricular ectopics. These fast rhythms are generated by microscopic clusters of rogue tissue, called ectopic foci, which fire rapid electrical impulses independent of the heart's primary pacemaker. Locating these misfiring clusters requires 3D electroanatomical mapping. As seen here, a mapping catheter is navigated inside the heart, gathering real-time spatial and voltage data. This constructs a virtual 3D wireframe mesh of the chamber, applying a color-coded electrical activation gradient to highlight the exact areas of abnormal activity. An electrophysiologist reads this gradient to track the signal backward, pinpointing the precise microscopic coordinates of the single rogue ectopic focus causing the chaos. This initiates the ablation phase, where we deliver highly concentrated energy directly to that mapped coordinate. Neutralizing this specific cluster of cells eliminates the abnormal electrical pathway, allowing the heart to resume a normal sinus rhythm. This process permanently cures the structural fault, providing a definitive solution that suppression through medication cannot match. When we zoom out from these microscopic interventions, the macroscopic result is clear: a globally synchronized, efficient heartbeat. Whether executing an electrical bypass, using leadless femoral delivery, deploying biventricular pacing, or mapping 3D targeted ablations, clinical resolution depends on the precise alignment of the mechanical symptom with the specific electrophysiological intervention. AstraCura is your premier partner in accessing these advanced clinical solutions. We invite patients and referring medical professionals to pursue comprehensive cardiac evaluation and expert medical facilitation with our network. To discuss specific clinical interventions, reach out to our team using the phone numbers or email address provided here. The future of cardiology relies on mastering the electrical architecture of the heart. AstraCura is here to help you navigate it.